NPH Insulin. Introduction. NPH insulin stands for neutral protamine hagedorn insulin. It is an intermediate-acting insulin used to control blood sugar levels in people with diabetes. Known by several trade names, Novolin N, Humulin N, Insulatard, and others. It is also referred to as isophane insulin, protamine zinc insulin, slightly different, and compound insulin zinc suspension, slightly different. Administration route, injected subcutaneously, under the skin. Legal status, in the United States, prescription only. In the European Union, prescription only, RX only. Mechanism of action, NPH insulin works by mimicking natural insulin to help lower blood sugar levels. The insulin is modified by adding protamine, a protein, and maintaining a neutral pH. The formulation includes zinc and phenol, ensuring controlled and extended release. The pharmacokinetics, onset of action, starts working in 90 minutes. Duration of action, lasts up to 24 hours. Side effects, common side effects, low blood sugar, hypoglycemia. Other possible side effects, pain or skin changes at injection sites, low potassium levels, hypokalemia. Allergic reactions, including rash or itching. Contraindications, should not be used by individuals with severe allergies to insulin or its components. Not recommended for immediate treatment of diabetic ketoacidosis or severe hyperglycemia as it has a delayed onset. Caution in patients with low potassium levels or those prone to hypoglycemia. Drug use as monotherapy or in combination. Monotherapy, NPH insulin can be used alone to manage blood sugar levels in people with diabetes. It is often used in type 1 diabetes and can also be used in type 2 diabetes when other medications are insufficient. Combination use. NPH insulin can be combined with short-acting insulin, such as regular insulin, for better blood sugar control. It can also be combined with oral medications like metformin for type 2 diabetes management. Most suitable combination: generics insulin NPH plus insulin regular premixed insulin, NPH plus metformin, and combination for type 2 diabetes. Most popular international brands containing this generic: Humulin N, manufacturer Eli Lilly, USA. Novolin N, manufacturer Novo Nordisk, Denmark. Insulatard, manufacturer Novo Nordisk, Denmark. Gensulin N, manufacturer BioVale, Canada. Silin N, manufacturer Saigon, Singapore. Adverse events, common adverse events: hypoglycemia, low blood sugar. The most common side effect, especially if the insulin dose is too high or meal timing is missed. Injection site reactions, pain, redness, or swelling at the injection site. Allergic reactions, rash, itching, or swelling may occur in some cases. Hypokalemia, low potassium levels. This can happen if insulin administration causes a shift of potassium from the blood into cells. Adverse events. Related to meal timing, on an empty stomach. Using insulin without food may increase the risk of hypoglycemia. With meals, it is important to take insulin in coordination with meal times to avoid hypoglycemia. With high-fat meals may slow the absorption of insulin, potentially affecting blood sugar control. Alcohol consumption. Alcohol can increase the risk of hypoglycemia, especially if consumed without food. Drug interactions, beta blockers, can mask the symptoms of hypoglycemia, low blood sugar, such as shaking, rapid heartbeat, and anxiety. Diuretics, for example, thiazides, can increase blood sugar levels, potentially requiring a higher dose of insulin. Corticosteroids can raise blood sugar levels, possibly requiring insulin dose adjustments. Alcohol may increase the risk of hypoglycemia, especially when taken without food. ACE inhibitors may enhance insulin's effects, leading to a higher risk of hypoglycemia. Sympathomimetics, for example, epinephrine, can increase blood sugar levels, potentially requiring a higher insulin dose. Food interactions, high-fat meals, slow insulin absorption, which can affect blood sugar control. Alcohol increases the risk of hypoglycemia, especially if consumed without food. Low-carbohydrate meals can increase the risk of hypoglycemia when insulin doses are not adjusted accordingly. Foods high in sugar can cause a spike in blood sugar levels requiring insulin adjustments. Pharmacology, drug class, intermediate-acting insulin. Formulation: a suspension made by mixing regular insulin with protamine, zinc, and phenol to slow its absorption. Action: controls blood glucose by increasing the uptake of glucose into cells and decreasing glucose production by the liver. Pharmacodynamics. Mechanism of action. NPH insulin helps control blood sugar by mimicking natural insulin. It acts on cells in the liver, muscle, and fat tissue to facilitate the uptake of glucose and reduce the amount of glucose produced by the liver. Prolonged action. Due to its formulation with protamine, its effects are sustained over 24 hours, providing long-term control of blood sugar levels. Pharmacokinetics. Onset of action. Starts working within 90 minutes of subcutaneous injection. Peak effect. Typically occurs 6-8 hours after administration. Duration of action. Lasts for 24 hours, making it suitable for once or twice daily dosing. Absorption. Absorbed more slowly than regular insulin due to its suspension formula. Metabolism. Broken down in the liver, and the active metabolites are eliminated through the kidneys. Half-life. Varies but typically around 4-12 hours depending on the individual's metabolic rate. NPH insulin. Additional detailed information. Maximum daily dose. The maximum daily dose of NPH insulin varies based on individual needs, including age, weight, activity level, and overall health. Typically, the dose is adjusted based on blood sugar levels. The usual starting dose is 10-20 units, but it may be higher in patients with severe insulin resistance or type 2 diabetes. The total daily dose generally should not exceed 1.5 units kg body weight for adults. Chemistry. Chemical formula. The chemical formula for NPH insulin is a complex mixture, primarily containing insulin, C6H12, N605S, and protamine. Molar mass. The molar mass of NPH insulin is approximately 5,800 Da for the insulin-protamine complex. Half-life. The half-life of NPH insulin is approximately 4-12 hours, depending on the individual's metabolic rate. Melting point. NPH insulin does not have a defined melting point due to its suspension form. The insulin-protamine complex crystallizes, which affects its dissolution in the body. Solubility. NPH insulin is water-soluble but forms suspensions when mixed with protamine and zinc, which affects its rate of absorption and prolongs its action. Organic molecule class. NPH insulin belongs to the peptide class of organic molecules, as it is composed of insulin peptides and proteins. Protamine. Bioavailability. The bioavailability of NPH insulin when administered subcutaneously is close to 100%, but is delayed due to its formulation as a suspension, which slows its absorption. References: Owens Dr. 1986. Book title: Human Insulin, Clinical Pharmacological Studies in Normal Man. Publisher: Springer Science and Business Media Findings. Discuss the pharmacological action and clinical use of human insulin, including NPH insulin, and its effects on blood sugar control. British National Formulary, 2015. Source: British Medical Association. Findings provides an in-depth look at various insulin formulations, including NPH insulin, and their use in diabetes management. World Health Organization, 2019. Source: World Health Organization Model. List of essential medicines country, Switzerland. Findings: NPH insulin is included in the WHO list of essential medicines for the treatment of diabetes mellitus. The Cochrane Database of Systematic Reviews, 2021. Study: Comparison of NPH insulin with other insulin analogs for type 1 diabetes management findings. Showed NPH insulin as effective, but compared to modern insulin analogs, NPH may have higher variability in blood sugar control. ClinCalC, 2022. Website: ClinCalC Findings. Provided data on the use and prescription statistics of NPH insulin in the United States, highlighting its continued popularity in managing diabetes despite newer insulin formulations. World Health Organization, 2019. Source: World Health Organization Model. List of essential medicines. Country: Switzerland. Findings: NPH insulin is included in the WHO list of essential medicines for the treatment of diabetes mellitus. The Cochrane Database of Systematic Reviews, 2021. Study: Comparison of NPH insulin with other insulin analogs for type 1 diabetes management findings. Showed NPH insulin as effective, but compared to modern insulin analogs, NPH may have higher variability in blood sugar control. ClinCalc, 2022. Website: ClinCalC Findings. Provided data on the use and prescription statistics of NPH insulin in the United States, highlighting its continued popularity in managing diabetes despite newer insulin formulations.